So the other thing is tongue thrust. Tongue thrust meaning that the patient like to push their tongue against the teeth. So when this happens, it can cause, we call it anterior open bite, where if you can see, there is actually a gap in front here. Okay, so when if your child or someone that you know have this anterior open bite, you have to go to two treatments, which is the oromotor myofascial therapy with a speech language pathologist, and at the same time you have to refer the patients to an orthodontist, because this can be corrected with an orthodontist or braces treatment. But at the same time, you also have to address the risk factor in this case, which is the tongue thrust habit. So that's why the therapy with the speech language pathologist is important. So in this case, the patient has undergone treatment with the therapist and also orthodontist. So this is the end result. Okay, the other thing about patients with autism is Bruxism or tooth grinding behavior. And some patients actually presented with this. So meaning that they have all this tooth surface already being, they grind their teeth. So there's like loss of tooth surface here. Okay, so what happened here is that the dentist, in order to manage this condition, the dentist actually do a stainless steel crown here on the posterior teeth to open up the bite. So if the patient grind, it does not cause further loss of tooth surface. Yeah. So if your child or whoever you know actually have this condition, please refer to a dentist because it can be controlled. It can be managed. Okay, gastroesophageal reflux disease is also quite common in patients with autism, and this can cause dental erosion such as this, which is loss of tooth surface. Okay, and the other thing is, Dr. Ilham mentioned just now, they have very high pain threshold. So usually they do not notice that there is any oral disease, any problems, until it is too late, when the patients actually develop like swelling, when they become sick. So at the end stage, the more severe stage, only they come to us for dental treatment. So at that time, not much that we can do. If the patients are brought in earlier, maybe the tooth can be saved. But if it's at a very late stage and the tooth is not restorable anymore, it has very poor outcome. So then we have to then if the tooth has to go, the tooth has to go, and this can cause other problems later, such as malocclusion, or the teeth will become crooked. Patients will have problems with eating, with speaking, and also the self-esteem of the patient themselves. Okay, the other thing about autism patients is self-injurious behavior. So like knocking head, biting the tongue, chewing fingernails or foreign objects, and also self-extraction. And I think Dr. Ilham experienced a case during MCO where the patient actually pulled out the teeth himself because I think the tooth was already mobile and he was having some kind of discomfort, so he pulled out the tooth himself. So maybe Dr. Ilham can share the interesting case later. Okay, and self-injurious behavior can happen because of it's just their habit, or it can happen during a temper or tantrum, and some of them exhibit repetitive or self-stimulating behavior, such as arm flapping, rocking, head banging. So when they do this, accidents can happen and they can injure themselves, and it can also when they injure themselves, in this case it can involve their teeth and also their head. So epilepsy patient, if they have a seizure attack, then this can happen, such as this tooth fracture and also this injury on the lower lips here. Okay, or also they tend to bite their tongue, and some of them actually can have like their tongue can be cut quite bad. So like this, please bring your patients, your children or your loved ones to get emergency care, okay, because it can be treated. Even with tooth fracture like this, it can be treated. So please come and get dental treatment from your dentist as soon as you can. So this is a bite guard, which is used by some patients to stop biting when they develop seizure attack. Okay, I've seen this being prescribed. Dr. Ilham also prescribed a lot of this to her patients. Okay. And then patients with autism are prone to trauma and injury because of their disruption to routine. And this can especially happen during the MCO because during this time they have to stay at home, and it's different to what they usually do on a normal basis previously. So they can be distressed and they can develop aggression and tantrum. So patients, we still treat patients during this MCO, but of course there are challenges. Reduced access, meaning that I usually see my patients routinely, even though they don't currently have pain, but I see them on a regular basis. Why? Because I want them to be familiar with the environment. I want to make sure that they do not have they do not develop oral disease. So we see them more often to give that preventative care and to make sure that they maintain good oral hygiene, to make sure that they actually receive all this frequent reassurance about oral hygiene care. So during this MCO, we only treat emergency patients. So we have reduced encounter with our patients. Some may need pharmacological intervention, which is also limited during this time, and some require management of multidisciplinary management, which may be limited during this time, and also the support system, because I understand that during this time is a challenging time for everyone. Parents or caregivers may have their own difficulties, financial difficulties, conflicts. So it is quite challenging for the support system as well. And this is how we look. So this is also a minus point, because when they see us like this, they become scared, because this is not the person that they used to know. Okay, because for patients with autism, they require familiarization, they require consistency. So when they come and see us like this, so they are not familiar, they don't know us anymore. So it's quite difficult for us to get that initial confidence and trust in them when we see the patients in the clinic dressed like this. So yeah.